Hi all, thank you so much for watching this video. Today we will discuss about the color codes used in the hospital or in the medical facilities. For the color codes, there is no specific definition, and at the same time there is no global standardization of colors for matching it. Color codes have varied widely by location. Even between the hospital in the same community has different color codes. So, what is the purpose of these color codes? To convey the essential information to the hospital staff with minimal misunderstanding and to prevent the panic in between the patient and the visitors. So, where we can find the hospital color codes? It can be found in the hospital policies or the general notice board, or it can be attached with the staff ID cards for the easy access. So let's talk about some common color codes. So first one is code blue. Code blue is announced once there is a cardiac arrest or any medical emergencies. So what happened? During a code blue announced, there will be a team which is already arranged by the hospital, which include doctors or nurses. So depends on the medical emergency, they will treat accordingly. They may be called as an emergency response team or a rapid response team. It depends on the hospital. The next color code is code red. This code is announced when there is a fire or smoke. During these codes, we should remember two words, that is raise and pass. In that, R stands for rescue. If you have the ability to rescue a patient, you can do that. A stands for alarm. Code red should be announced. Then C stands for contain. If you have the ability to contain a fire, you can do that as well. E stands for extinguish or evacuate. If you are trained or if you have the skill to use the fire extinguishers, you can use to put down the fire, or else you can evacuate. The second word is pass. This word helps us to use how to use the fire extinguishers. In that, P stands for pull the pin. A stands for aim at the base of the fire. And S stands for squeeze the lever. And the next S stands for sweep from side to side. The next code is code orange. This code is announced when there is a mass casualty. This happens outside the hospital, which can be a result of an external disaster or any other unprecedented events. So what happened inside the hospital? The whole hospital team will be get ready by arranging adequate staff and enough equipments. Once the patient come inside to the hospital, by doing a triage, they will rectify and they will prioritize the patient accordingly. Next, we will speak about code green, that is for evacuation. When this code is announced, everyone in the hospital, including the staff, patient and visitor, should be evacuated to a safer place. This can be due to a fire or a bomb threat. Next, we will talk about code amber and code yellow together because both are related with missing. Code amber is missing child or infant. Code yellow is missing patient. Once this code is announced, the hospital premises will be thoroughly checked, and in some places the exit doors will be closed. And if they remain lost or if they couldn't find out, they will inform the higher authorities. The next code is code brown. This code is announced when there is a hazardous material release. It can be chemical, biological, nuclear or radiological. According to the safety data sheet, that can be treated or managed. Next is code white. Code white is declared when there is a violence or aggressive behavior. So during that time, we have to inform the concerned department. They will do the needful. And next one is code gold, which is declared when there is a utility failure. It can be a error or a failure from the IT department or any software problems our system. Code silver is weapon or hostage. If a person is having a weapon or if he holding someone as a hostage, code silver is declared. And next one is code black. That means a bomb threat. If a person, or if you are getting an anonymous call regarding the bombs, it is code black. And the next one is code gray. Code gray is regarding the weather warning. So it can be a rain, it can be a sandstorm. So for that we are depending on the authorities, higher authorities instructions. Once again, I would like to bring the point that the color codes are not at all globally standardized. So even these color codes can be different in different hospital and in different location. Once again, thank you so much for watching this small video. Hope this will help you in the future. Thank you.